Hi, my name is Lorraine, and I am creating this video as an assignment for Aspen University graduate program 605 Substance Abuse Prevention. This is week 4, this assignment 1 for week 4. The basic plan is to develop a program that targets addictions issues in my community. I've chosen to target the adolescents and youth. This particular assignment is looking for the key considerations for building capacity for this target prevention program. So the first thing I'd identified is I needed to find out what services, what assets our community has. We've got probably a dozen schools that are very active. We also have alternative school. We have a homeschool group. We have Boys and Girls Club of Lebanon. We have Teen Challenge, which is a religious-based self-improvement / addictions program. Oregon Youth Challenge program, which is the National Guard youth program. We have a Linn County Health Services that offers both mental health and addictions treatment. We have Yes House, which is a residential adolescent program. We have Emergence, which is a opiate recovery and pain management therapy program based out of the local hospital. Diversity and cultural engagement programs. We have the Linn County offers specifically a women's program. We have some adolescent and drug treatment programs specifically through Linn County. We have several medical providers, both a hospital, a medical school, and lots of doctors' offices. We have the law enforcement justice system. We have churches, parks and recreation, not very active in our town. Lots of businesses. The library is very community active. Local newspaper, the Rotary Department, the American Legion, the Optimist Society is quite active in our town. Alcohol Anonymous and Narcotics Anonymous groups would be a great resource. We also have access to all of the city leaders. We're a fairly small town, and they're usually fairly open to talking with community members. There's a list of that information on the city website page. So the first thing I need to do after I've identified the community members, I needed to identify what the need was. So gathering data about addictions issues in youth from the newspaper, from local city records, from school records, from any health records we might have access to, will be important to kind of getting a little baseline on what the current issues are. Once we've got that information, we're going to develop a questionnaire that will be used to talk to the leaders of the town, the leaders such as the mayor, some of the leadership in the school, with the purpose of basically eliciting their feedback on what is successful in our town and what is not, finding out what they like, what they don't like, what they think needs to be happening, and finding out if they're interested in, or if anyone underneath them might be interested in partnering with somebody to address specific needs and what those specific needs might be. Once we've identified the leaders and met with them, we will take that information, and hopefully a few of them will be willing to partner with us to start this new program. The next thing we'll do is create a questionnaire for the community, and this questionnaire will ask about existing resources, what their perceived needs are they willing to participate in developing or implementing services, and any other feedback they may have about adolescent and addiction treatment in Lebanon. These questionnaires will be handed out door to door, at the library, posted on the Lebanon Facebook page. Kind of just a general smattering of community interest. Once that's done, we'll take that information, expand the questionnaire, and advertise, hold a forum, community-based forum, to discuss these issues more completely. And these will be advertised much more intensely. The questions that we'll be asking in this one will start with, and the questions at this forum, we'll have papers people can fill out. We'll also do interviews with people. The basic kind of questions we're going to start with are, what do you like about living in Portland, or in Lebanon? Why do you like this? What are some of the strengths that our community has? Do you have any children who live in our community? Are you aware of any drug or alcohol issues our youth face? What is being done in the community to combat that? Are there services designed to educate? Are these services designed to educate, prevent, reduce, or treat addiction issues in our youth? Are these services sufficient for the needs of our community? What are some of the things that could be done to improve our community? What issues do you feel are not being adequately addressed with our youth and addictions? Are you willing to join the task force to better understand and create additional services for our youth? And do you know anyone who would be interested in helping with this effort? Once we've done this with the community, we'll take the people who will take the information to determine what needs to be done with it. We'll take the people who have expressed an interest and willingness, come together to review the information to decide what the actual need is. And then we'll start the process with this group of people to greater identify the needs and start creating a plan, developing a plan that will meet those community needs. So that's the process that I've got created so far. Thank you very much. Bye-bye.